Good morning. My capstone project examines artificial intelligence as a strategic opportunity for St. Luke's University Health Network. Rather than viewing AI simply as a new technology, this presentation will examine how it can be strategically implemented to improve workforce productivity, operational efficiency, and financial performance while maintaining appropriate governance and human oversight. I will briefly review the business opportunity, financial implications, recommendations, and implementation strategy. The business case for artificial intelligence is driven by three interconnected challenges. First, healthcare organizations are facing increasing workforce and administrative pressures, including the burden associated with clinical documentation. Second, AI presents an opportunity to improve productivity by automating repetitive administrative tasks and reducing the time clinicians spend documenting. Finally, AI can improve financial performance through applications such as revenue cycle optimization, and claim denial prevention. My recommendation is that St. Luke's approach AI as a strategic business investment using strong governance and a phased implementation process to capture these opportunities while maintaining appropriate oversight. St. Luke's is operating in an increasingly complex healthcare environment. Workforce shortages place additional responsibilities on existing employees, while documentation, scheduling, billing, prior authorization, and other administrative requirements consume significant staff time. At the same time, rising labor and operating costs and increasing patient demand are putting additional pressure on healthcare organizations to do more with existing resources. The strategic challenge is therefore not to simply reduce costs, but to improve efficiency and workforce capacity without compromising patient-centered care. These challenges create the business case for exploring artificial intelligence as a strategic solution. The evidence suggests that artificial intelligence can directly address one of the challenges identified in the previous slide, administrative burden. A recent meta-analysis conducted by Lin and others found that generative AI reduced documentation time by approximately 40%, while AI voice recognition and scribing technologies reduced patient charting time by 28.8%. In one implementation, AI-assisted documentation saved physicians approximately 1.5 hours per day. These findings demonstrate that the opportunity is not simply to introduce new technology, but to return valuable time to healthcare professionals and increase organizational capacity. Productivity is only one part of the workforce opportunity. Administrative burden also contributes to clinician burnout and can take away from patient care. In a 2025 study published in the JAMA Network Open, clinical burnout decreased from 51.9% to 38.5% following implementation of ambient documentation technology. You and others also reported improvement in documentation burden and clinician well-being. These findings support using AI as a tool to augment the healthcare workforce by reducing administrative work rather than replacing the human element of care. The financial opportunity extends beyond productivity. Artificial intelligence can also strengthen revenue cycle performance by identifying potential claim denials, documentation deficiencies, and coding issues before claims are submitted. Industry examples reported by the Healthcare Financial Management Association include reductions in denial rates ranging from 18 to 22%. One healthcare system reported improving its first pass claim yield from 85 to 92% and generating approximately $40 million in additional net revenue after implementing AI-supported denial prediction. While these results should not be assumed to represent the outcomes St. Luke's would achieve, they demonstrate the potential financial value of strategically implementing AI with revenue cycle. Our strategic analysis identifies both significant opportunities and important challenges. St. Luke's has an established healthcare infrastructure and network that can support AI adoption, while AI presents opportunities to improve productivity and reduce administrative burden. However, implementation costs, workforce adoption, cybersecurity, privacy, and potential bias must be addressed. Based on this analysis, the recommended strategic direction is not immediate network-wide adoption, but a phased and governed approach that allows St. Luke's to demonstrate value while managing risk. The first recommendation is to establish a formal AI governance structure. The purpose is not to slow innovation, but to ensure that AI investments are aligned with organizational priorities and implemented responsibly. A cross-functional governance team should evaluate proposed AI applications based on strategic alignment, patient safety, data privacy, financial value, and organizational risks, according to BAJA 2021. Executive oversight would provide accountability while allowing clinical, operational, technology, financial, legal, and compliance perspectives to be incorporated into decisions, according to the American Hospital Association in 2025. The second recommendation is to prioritize AI-assisted clinical documentation as an early implementation opportunity. Documentation represents significant administrative burnout for clinicians and is an area where AI has demonstrated measurable benefits. A recent meta-analysis found that generative AI reduced documentation time by 40%, while AI, voice recognition, and scribing technologies reduced charting time by 28.8%, according to Lin in 2025. In addition, research published in JAMA Network Open found a reduction in clinician burnout following implementation of ambient documentation technology from you and others in 2025. Combined, this evidence suggests that AI-assisted documentation could provide St. Luke's with an opportunity to improve productivity while also supporting workforce well-being. The third recommendation is to expand artificial intelligence into revenue cycle operations. AI can identify documentation, coding, and other issues that may lead to claim denials before claims are submitted. Industry examples reported by the Healthcare Financial Management Association include reduction in denial rates ranging from 18 to 22%, according to Adelke in 2026. One healthcare system reported improving first-pass claim yields from 85 to 92% and generating approximately $40 million in additional net revenue after implementing AI-supported denial prediction, according to Adelke in 2026. These examples demonstrate the potential financial value, although they should be viewed as reported outcomes rather than guaranteed results for St. Luke's. Implementation should occur through a phased approach rather than an immediate network-wide rollout. During the preparation phase, St. Luke's would establish AI governance, select an appropriate pilot, establish baseline performance measures, and prepare stakeholders. The pilot phase would focus on implementing AI-assisted documentation, monitoring outcomes, gathering employee feedback, and evaluating financial and operational results. If the pilot demonstrated measurable value and acceptable risks, successful applications can then be expanded to additional departments. This approach allows St. Luke's to learn from implementation. Success should be evaluated using measurable key performance indicators established before implementation. Workforce measures will include documentation time, burnout, and employee satisfaction. Operational measures will include productivity, administrative time, and AI adoption. Financial measures will include claim denial rates, first-pass claim yield, and return on investment. Patient experience should also be monitored to ensure that improvement in efficiency does not come at the expense of patient-centered care. These measures will allow leadership to determine whether AI is producing the intended organizational value and whether successful applications should be scaled. Artificial intelligence presents St. Luke's with an opportunity to address workforce pressures, improve operational efficiency, and strengthen financial performance. However, successful implementation requires more than purchasing technology. St. Luke should establish strong governance, begin with high-value pilot applications such as AI-assisted documentation and revenue cycle optimization, measure outcomes with defined KPIs, and scale successful initiatives based on demonstrated value. This approach allows the organization to pursue innovation while protecting patients, supporting employees, and maintaining financial accountability. Ultimately, AI should be used as a strategic tool, that complements healthcare workforce and strengthens the network's ability to deliver high quality care.